What's up, everybody? This is Dr. Craig Kasper from NYHD and the Institute for Hearing and Balance, and we're back with another Audiologist at Home episode. And today we have Dr. Alexandra Zweig. And how are you today, Dr. Zweig?
I am well. How you doing?
Great. A little change up of the set there, the scenery in the house. You went to a different room.
Yeah, keeping you guys on your toes.
Gotcha.
Give you a tour at the same time.
So, in addition to giving us a tour, what we're doing is we're going through some questions that we get on a regular basis, and also some things that we're trying to do to add value while everybody's stuck at home during this time of shutdown. And today, we have a question that is really interesting because it's something that we do quite a bit in our practice. And it's talking about the concept of falls. And a lot of people are at risk for falls, but the question really is, what puts someone at risk for falling?
Yeah, so I think this is definitely a topic that is not discussed enough in healthcare, not only in an audiology practice, but maybe across different healthcare professionals. And the reality is 1 in 3 persons over the age of 60 are at risk for falling each year, or, researchers do fall each year. And this is a trend that will increase by about 50% by the age of 80. So some consequences of falls, they might seem kind of obvious: injuries include fractures, head traumas, joint dislocations, anything that's going to kind of limit activity or cause activity restrictions, and for some, even death. And that's the unfortunate truth. So it is something that's pretty important, and something that needs to be discussed more on how to prevent them. And the good news is that we can prevent falls through intervention programs that are kind of contingent upon identifying those early factors that might be contributing to the fall. So that's what we're going to talk about today. So some factors, and we take a look at 2 branches that we're concerned about, and they're intrinsic factors, which are more related to someone's health, as well as extrinsic factors, which are kind of more environmental, so things we can control in your environment. So let's start by talking a little bit about the common intrinsic factors that play a role. Some of these are controllable by a person, some are not. So for example, the first one being age. Can't really control getting older, but that is one of the factors or intrinsic factors that might cause some falls. History of falls. Research shows that if you've fallen before, you're more likely to fall again. Things like cognitive impairment, depression, certain medications that we take. So antidepressants are related to increase in falls, as well as certain sleep medications, muscle weakness or numbness, vision. So issues with our vision, as well as balance disorders, which is something inner ear related that we do assess in our office pretty often. Gait, so the way our kind of feet touch the floor and how we're walking. And hearing loss plays a pretty important role as well. There's a lot of research to show the connection between hearing loss and falls. In fact, approximately 2 out of 3 people or older adults who fall do happen to have hearing loss as well. And then the last factor, not the only factor, is the cardiovascular disease, and I'm talking more about orthostatic hypertension, which is a rapid change in blood pressure from a sitting position to a standing position. So those are some of the intrinsic factors that we take a look at.
All these are clearly super common as well. Almost everybody experiences at least one, if not multiple, components of what you just described.
Yeah.
So interesting. Okay. So you were going to talk about some extrinsic factors now.
Yes, so that's the second branch, and that's things within the environment that are going to contribute to falls. So that's things like poor lighting in the environment, unsafe stairways, so maybe stairs that are too steep or in poor condition, uneven floors. That's when you have a rug on a hardwood floor or loose rugs. Things like outside surfaces like sidewalks that might be uneven, slippery surfaces, and even the footwear, what we have on our feet at that time. So those are some environmental factors that we can control, or probably more that we can control than maybe the intrinsic factors. So both of them, both intrinsic and extrinsic factors, may put an individual at risk for falls. So basically, what do we do at this point? How do we create this intervention program? So something that we've kind of implemented over time in our practice is assessing these factors through self-assessment tools or questionnaires. We take a look at patients' gait and their balance ability or vestibular system through a series of testing. We do a hearing test. We have orthostatic hypertension screening. We can assess extrinsic factors by home safety checklists. That's something that I've definitely handed out to patients, and kind of a next video will probably talk about tips to preventing some of those issues, or fixing some issues in the home, or things we can look for outside, as well as looking how we can control the intrinsic factors, which I think is probably more interesting. And that is definitely a whole other video in itself.
Yeah, those are really important components, clearly, of someone's safety and well-being, as well as longevity. When we talk about longevity, which is what a lot of our patients talk to us about, is how do they live a longer, healthier, more productive, involved life? Falling is one very easy way to take us out of the game. And ultimately, for a lot of patients, when they fall, it's an unfortunate downward spiral, and it takes longer for them to kind of get back up on their feet and back involved in the life that they want to live. So I loved all of that. And I think it's really important that we dive into some of those details in some future videos, because maybe giving some tips and tricks and dealing with some of the checklists that we deal with, and sharing some of that information will be very helpful to some people out there as well. So really, really important information today. So as always, thank you so much, Dr. Zweig. We appreciate your insights. And this is a really important topic, along with all of them, but this is something that can affect potentially us in a very, very negative way. So really important information. For any of you guys who have questions out there, you can send them to info@newyorkhearingdoctors.com, info@newyorkhearingdoctors.com. And we will do our best to make sure that we're trying to answer those questions in upcoming videos. Thanks, Dr. Zweig. I'll take care. I'll see you later.
Yeah.
I will take care, and I will see you later.
Good. I'll see you later. Take care.
All right. Be well. Take care.